What we've done is alter for patients on the island the way they're treated. One of the important things in breast cancer surgery is to find out if any trouble spread to the lymph nodes. In the old days, we removed all the lymph nodes, examined them, and in 60% of cases found no one had any trouble in them. Nowadays, we find one lymph node to which trouble might go. We cut that lymph node out at operation, we examine it whilst the patient's asleep, and only go on to remove the other nodes if that node is involved. So this saves 60% of people unnecessary surgery. It also has large cost savings for the trust because people are in much less often. As they stay fewer nights, they have less infections, they have less collections of fluid afterwards, there's less arm swelling afterwards. So it's a win-win, win for the patient and win for the trust.
There's been an incredible change to the service delivery. Previously, it would take 16 weeks from the time a patient was referred before we imaged them. There's been a dramatic change through the new ways of working with the staff. They've had to embrace new technology. Images are available to the clinics and to doctors within minutes of them being captured, and the reports are available online within 24 hours. The change for patients is that they used to spend an incredibly long time within the department. Now when they walk in, we offer a walk-in service. They're seen within half an hour. Because of the digital technology, we're able to offer that up to the wards now. Previously, we'd been identified as blocking beds with patients waiting to come down for imaging. Now, for the general department, we can offer the wards open access to us at a time that suits their nursing staff and a time that they can get porters.
One of the main dispensing errors is choosing the product. Now that can be putting stock away on the wrong shelf, products look very similar, strengths look similar. We relied on somebody putting something away in the right place and somebody selecting it from the right place. So that was a major cause of error. Now that we've had the robot in for a year, we've been able to really look at the time that we've saved and how we've used it. The time that we've saved in loading up the stock now means that we are providing a top-up service at ward level to make sure that the nurses who are doing the stock up, that's now freed up their nursing time, and our staff are up there managing the stock for them. In terms of the dispensary, we've freed up technician time so that technicians are now on the wards talking to patients about their medicines. The patient survey showed that patients wanted to know more about their medicines before they went home. We're now responding to that. In the past, we used to have to wait for a doctor to write a prescription to go home with. Now we can put that information onto a discharge summary, start the dispensing process there and then. Within half an hour, we can have medicines ready to go home. National average is 4 hours. People are coming here now to find out how we do it.
When you live with a chronic lung disease, being breathless is a normal part of everyday life, and what people often do to avoid becoming breathless, they start to avoid doing certain tasks and they get into a downward spiral of disability. The aim of pulmonary rehab is to break that cycle and enable them to increase their fitness, increase the amount of normal day-to-day activities. About 1% of the population of the Isle of Wight's got COPD, which we think is just the tip of the iceberg. We really need to be getting out there and offering this to more people. So we were able to secure funding to develop the service further, and one of the unique extras about this service is we have clinical psychology input, which really helps us to address some of the thoughts and fears and anxieties that people have around getting out of breath. And for some people the changes are much smaller, but they're still significant and can make a big difference. Like, I was able to make a cup of tea without having to sit down in the kitchen for 10 minutes while it went cold and go back to the living room.
Looking after larger people within our hospital is now quite a big deal. It's something that we need to be doing on an ongoing basis, and I think it's very important that everybody is treated with, privacy and dignity and has access to the same services. So we've worked very hard all together to try and get the equipment and the facilities that are needed to actually put those sort of systems in place. Our focus this year in our moving and handling refresher training is about the equipment that is available now, to make sure that everybody knows what is available, how to use it. 2 years ago we had a specialist group of beds that we had to sort of look out for, so now we've got a lot more beds. And I think one of the things from a privacy and dignity point of view that we haven't mentioned is the fact that we haven't had hospital gowns for all that long. In some cases, people didn't have suitable clothing in bed. It's quite a different aspect to the care that we've considered in that time.
This initiative is about trying to improve a patient's chance of surviving a life-threatening emergency in the home, in the street, in their workplace. We have 2 schemes here on the island. We have co-responders, and they are in full partnership with our professional colleagues in the fire service. We also have first responders, and these are community-based, and these are members of the public who've agreed to undertake training, and they volunteer to do this. They go about their ordinary everyday lives during the day and the evening, and they're available to be on call to the ambulance service to attend life-threatening calls in their immediate vicinity. In the very first few minutes of an emergency, every second counts, and situations such as a heart attack, someone choking, a severe asthma attack, a stroke, someone having a seizure, the first few minutes mean all the difference, and what happens then can be the difference between life and death. We have 7 people who were unconscious and weren't breathing and whose heart wasn't beating effectively, who, thanks to the response, the very quick response of both first responders and co-responders, had a return of spontaneous circulation. By that I mean through treatment their heart started beating correctly, and they are alive now to this day.